I do work for Interact for Health. For years, I was the Senior Program Officer in charge of our efforts in the area of substance use disorders. With the change in our name to Interact for Health, I have moved to being the Senior Program Officer in charge of healthy choices about substance use. So it's just, we're not focusing anymore from our perspective on the disorder as much as we are on promoting the positive. So we know that people use alcohol, people use prescription drugs. We want to focus on the healthy use of those from the Health Foundation's perspective. See, I still do it from Interact for Health's perspective. So we try to focus on it. My work in the heroin epidemic began several years ago, and I told the board and staff of Interact for Health that I could not leave this work behind. That we needed to stay engaged in this until we felt like we were over the tipping point of getting people engaged. So that's my job now, is to be a catalyst in our community to get work done. So what I'd like to do right now is, all of you came here for a reason. It wasn't just for the wonderful lunch. It wasn't just because you knew I had a Southern accent and you wanted to hear me talk. You wanted to know something. And so what I'd like to do is I would like to take just a couple of minutes and have you tell me what it is that you want to know before you leave this room. Okay? So I'm going to write those down because my memory is not as great as it used to be. Let's see if I have one that writes. Yes, so tell me, what do you want to know?
I want to know where your Southern accent is from.
Oh, Louisiana. Louisiana. I've lived here for 30 years, but you haven't been able to erase it. So, yes.
I want to know if the community is going to do anything to improve the treatment programs.
Okay.
I second that.
Okay. And y'all, excuse me, I'm going to use abbreviations because I don't want to have to write everything out. So, okay. What else? What else do people want to know? Yes.
I want to know where heroin came from. I mean, I remember heroin in the 60s and the jazz scene and then methadone, and then it sort of disappeared, it seems. And now it's right in my mouth here.
Okay. Yes. And I'm taking from that you really want to know where, why now?
Yes.
A why now question. And you don't want to just know that we're getting it from Mexico?
No.
Okay.
So my question was going to be, what's the source? So it's all coming in
Mexico.
from Mexico?
Mexico through Chicago is what we're
entirely.
learning. Not entirely, but
Some of it's coming from Afghanistan.
some, but very little in our community. In our community, Afghanistan heroin goes to other places in the United States. So, most, yes.
Guatemala is also a source,
Okay.
Very strong source.
Mm-hmm. Okay. Yes, Chuck.
Integrating our society.
And how did it get integrated into our society?
Racially.
So what is the racial mix of what's going on? Okay. Yes.
I want to know if the business community in Cincinnati is coming to the table to help combat the problem.
Okay. And if so, how?
And if not, how do we get that?
How do we get it? Yes. Okay. Yes.
Is it connected to our prison system?
Okay. And someone right over there, I can see a hand go up, but yes.
You have a clue on how to proceed to solve the problem?
Okay. No. Solution. Okay. Yes.
I had the same basic.
What's the solution?
Control it.
Okay. Yes, David.
If it is an epidemic, not only in the metaphorical sense, but in the literal sense, what could we expect from the response from the medical community, from university hospital? Could detox be expanded, for example?
Okay. All right. That one will get answered in some of this. So, okay, yes, sir.
And I'd like to know why the demographics of use have changed so dramatically. Ed talked about, in the early days, we saw a totally different kind of person engaged in heroin use. Now, it is engaged with young people predominantly, and this is not the way it was. I'm a retired physician. I used to treat these overdoses that would come into the emergency room before Narcan, and it was a totally different kind of person that came in.
Yeah, absolutely.
Than we're talking about here.
Okay.
These are.
Yeah, I can tell you exactly
Okay,
why that's going on. Yes, ma'am.
My question is, why now?
Okay, good. All right. All right.
And what about programs in our high schools to educate the kids?
So you're talking about prevention?
Yeah.
Okay.
Yes.
All right, we'll talk about prevention and what can be done there. All right, now, there are some people in the room who are at least as expert as I am on this. And so I'm going to ask them to not be shy and to join in the conversation whenever it's available, whenever you can. So, okay. Let's see. I'm going to start by saying a year ago when I came to talk with you all, we knew that there was an epidemic. We could see it happening. It is an epidemic in both the medical sense and in the headline sense. Epidemic makes good headlines. But it's actually in the medical sense, we can see it. And I brought about 5 slides. So you all, I'm not a slide person in most of this, but I wanted to show you some things because I think they're better seen this way. Okay, this is what the heroin epidemic, what hepatitis C looked like in our community back in 2008, 2009. The darker the color, the more cases. And the cases that are shown are new cases in those years. So this is 2008, 2009. This is 2010.
The relationship with heroin is...
Oh, okay. Hepatitis C is, thank you. Hepatitis C is a drug that is a disease that is transmitted by blood. It's a blood-borne pathogen. And one of the reasons why it's transmitted is through needles, through syringes that are shared between one addict and another. When one of the addicts already has hepatitis C and transmits it to another. It is one of the leading causes of liver disease in our country right now. And it is growing by leaps and bounds. And it is extremely infectious, more so than HIV, in that it lives outside of a human host for up to 2 weeks. That's the general rule of thumb, is that it's a 2-week window. So a syringe that is on the ground that someone might see or leave behind when they've used drugs is infectious if they had hepatitis C and it has any blood in it or on it. It's infectious for a period of time. So that's why things like picking up dirty syringes in the community, if you know how to do it and you have a sharps container, is important. That's why having syringe exchange, and we'll talk more about that, is a life-saving and community safety way to do things. So hepatitis C, we look at hepatitis C as a proxy for heroin use in the community because it is very much connected to injection drugs. So, This is 2008, 2009. This is 2010, 2011. This is 2012, 2013. What you can see is that the map is getting darker as you look at that. With hepatitis C, and the other thing that you could see if you followed those is that this was already, our over the Rhine downtown area was already had a large number of new cases in it. What happened over the past 6 years is that the cases became more widespread. You could see more cases coming in Westwood, Western Hills area, up in the northern part of the county, and this is just our county. The same thing is happening, this is just Hamilton County. The same thing is happening in all of the counties that surround us, particularly in northern Kentucky. Northern Kentucky has seen a 500% increase in new hepatitis cases in the 15 to 25-year-old range. That we have a group of kids that are out in the Claremont-Brown County area who used together. All of them now have hepatitis C because they were sharing needles, because they thought, oh, we're all safe. Well, one of them shared with somebody outside of that group. All of these kids were 15 years old. They now have a chronic disease that they will carry with them for their lifetime and will probably shorten their life. We do have some cures now to hepatitis C, but extremely expensive. So I talked a little bit about this last year when I was here and met with you all, and I wanted to say that we've gathered more evidence. We know what we're seeing. We still have, people die